Good evening, everybody. Hello, I'm talking to you at 6:30 in the evening from Geneva in Switzerland, at the border between Switzerland and France. And obviously, good morning to those of you who are west of us, and good late evening to those of you who are east. We're very pleased indeed that you've joined us for this third of our open online briefings about COVID-19. And what I'm going to do today is to give you a short summary of the state of the COVID pandemic. I'm also going to talk a little bit about some of the challenges in responding to the pandemic. I'm going to go into some detail about the impact of the efforts to contain the pandemic on different sections of society around the world. Going to look a bit ahead to what the world may well be like as we emerge from the pandemic. Now, the usual approach that we've just found useful in the last of the two briefings that we've done is that I talk for about half the briefing and then we deal with questions. But this time, we're going to try to shorten my remarks to give more time for questions. And we will also do like this. We will collect the questions together and then we will present sort of omnibus answers to a selection of questions. And so if you don't mind using the chat function on this Zoom, it seems to be quite a good one. And there are several of us in our team who are looking at the chat line. I won't look at it, I'll try and look at the camera, and they will tell me what are the questions. In that way, I hope that we will address some of your concerns. And also, we will point to where we've got a number of things posted on our website. This is the 4sd.info website, where we have some narratives about COVID. Now, of course, somebody who's like myself working as an envoy for the World Health Organization has functions that involve me operating at different levels. And I was thinking, what's the most useful thing to do today? And I'm going to try to be quite practical. I'm going to focus on the sort of issues that most people in most places are really wrestling with as they try to come to terms with and make sense of this pandemic. I think that this time I won't go into a lot of detail about history. I'll just remind you that it is a disease, a viral disease caused by a pathogen virus that goes into the chest and leads to an infection inside the chest, and that infection can be very seriously disturbing and sometimes fatal in a small number of instances. And the people who are most likely to suffer and die are people who've got other illnesses and also people who are older. And the death rates are significant. And when there is a big outbreak of COVID in a particular geographical area, quite quickly the health services get full. And that's because the multiplication rate of this virus and the way it's transmitted between people is extremely quick. And so an outbreak can appear and really double in size and then double again, super rapidly. And that's why we're always saying, whenever we talk to anybody about trying to prevent outbreaks from forming, we're saying, go there early, Actually stop the transmission quickly, because if you wait for any reason, then all that happens is the number of people with COVID builds up, and then you end up, as I said, with overflowing hospitals and very exhausted health workers. Right at the moment, we have been seeing the development of quite large outbreaks in Europe. We have had one in Italy, which has proved to be really challenging in northern Italy, that is, for the Italian authorities to contain it and to bring things down to normal. And in fact, they're still really working super hard, and the figures from Italy are quite challenging. There's also a large outbreak in Spain. It's in various locations in Spain. And that too is quite disturbing. And there are lots of challenges in getting that particular outbreak under control, but it's coming. Then there are outbreaks in France. Again, they're quite focal, but they're extremely serious. And there are many thousands of people with COVID in France at this time. There's an outbreak brewing in the United Kingdom. We're not quite sure where it's going to grow. There's an outbreak there are outbreaks in other countries throughout Europe. And in fact, there are outbreaks in most countries all over the world. It's Europe that's got the big ones right now, but we've also seen the United States building up, and with outbreaks in many different centers in the United States that have really built up since I did the last of these online briefings, with New York perhaps the one where there's the majority of the US cases, but also we're hearing of cases in other centers, particularly cities in the US, and that's everywhere from New Orleans to Chicago, from Seattle into California. And we're anticipating that those outbreaks in the US will go on growing and will continue to cause challenges for health services. How do you deal with a big outbreak of COVID, one where it's kind of exploding in front of you and you're hearing every day quite horrendous stories about what's going on? Answer, you have to stop the transmission of the virus from person to person. And the only way you can do that is to ask people who have got symptoms of the disease, especially if they've got a positive test result, but even if they hadn't, if they've got the symptoms, we ask them to be isolated from others. And we ask them to stay 2 meters away from other people, because the droplets which transmit the virus, which are coughed out or sneezed out when people are close to each other, they travel about 1.5 meters. So if you're 2 meters away from somebody, you're safe. And if you can wear a face mask, if the ill person can wear a face mask, then that adds to your safety. All the time we're trying to stop transmission from person to person. But when outbreaks are very severe, you can do something else to try to reduce transmission. You can actually stop people being close to each other. You can introduce physical distancing throughout a society. And you do that by asking people not to be close to each other. But unfortunately, we're social animals, us humans, and we like to be close together. And so what governments in many countries have had to do is to actually force people to be apart from each other through issuing shelter-in-place orders or stay-at-home orders, or even going one stage further and doing a total lockdown of the economy with really no activity at all, no traffic on the streets, no one getting close to another person at all. You just stay with your family at home. Did you know that at the moment, more than 30% of the world's population is in lockdown? It's an extraordinary number. And these people who are in lockdown are in 70 different countries and territories. Lockdown is the way of life right now for hundreds of millions of people. And so just one little thing I want to get rid of there. What we do have, we've got Zoom bombers who come in and affect our Zoom, and they do quite unpleasant things. So we do try to get rid of them off the call quite quickly. Just say that we see you and we know what you're doing. So this thing is an ongoing challenge, and we are seeing, as I said, in the US now, some big outbreaks building up, and we've also got outbreaks now occurring in other parts of the world, particularly in poorer countries. And they include, of course, India. They also include South Africa and other countries in Africa. They include countries in Central Asia, countries in Latin America. And the speed at which the pandemic is spreading into those geographies is quite extraordinary. And so we are now working very closely with all countries on trying to make sure that they can put in place the necessary activities to stop transmission and do that as quickly as possible, and then introduce these physical distancing measures to try to keep people apart from each other. Now, a little bit more about the physical distancing measures and the lockdowns. What we're learning is that the lockdowns actually are very damaging for economies and societies. And right now, we are working with governments who are introducing lockdowns to see whether or not it's possible to actually reduce the impact of those lockdowns, particularly on poor people. So let's just go through just the three big themes. All the time trying to concentrate looking at the camera while I see that there's some weird stuff going on. So what we're doing now, firstly, is encouraging the establishment of public health services that are capable of identifying people with the disease and reducing the expansion of outbreaks. Secondly, while we're also encouraging the proper management of lockdowns, and during lockdowns, we're suggesting that if those lockdowns take place, there should be a proper attention to the problems faced by people who are unable to get employment and who can't go to work. Third thing we're doing is working hard on working on the plan for recovery and transition to recovery after the current phase of intensive outbreaks. And that's something we're doing as well. And I think by and large, that's going quite well, but we have got a lot more to do on it. So if I go in now to some of the specific issues that I really want to focus on. Firstly, trying to make certain that it's possible that every health worker everywhere can get access to personal protective equipment to maintain their health, and also can get access to hang on a minute, we just got to ask.
Go on.
Okay, good. Get access to personal protective equipment and can also get access to testing, because at the moment, health workers in many countries can't get testing to see whether or not they've got coronavirus. Secondly, we want to work very hard on trying to make certain that communities are organized so that they're able to identify people who've got coronavirus and isolate them. Thirdly, we are working extremely intensively with governments on trying to make sure that in places that are affected by coronavirus, that there are not shortages of food that lead people to go hungry, and also create further challenges because people are anxious about their access to food. Now, to deal with these kinds of issues, we are working a lot with businesses, and we're particularly focused on three specific issues. The first with businesses is trying to work on the security of supply chains for essential items, and also to deal with market failures when they exist. Secondly, we're trying to work on medical equipment and making sure that that is available and in decent supply, and trying to prevent counterfeit medicines or fake cures being advertised and taken seriously. Thirdly, we're working a lot with companies on COVID-19 vaccines and medications. So this is a major issue. Let me just describe each one of those in turn. Let's start with supply chain security and integrity. If a supply chain is breached as a result of border restrictions or transportation transportation challenges, this can really disturb business and lead to unnecessary costs, inefficient delivery schedules, and also quite a lot of security for intellectual property. And there's been a lot of fear about what's happening in relation to the pandemic, and this is leading to borders being closed and some extra checks being put on goods when it's very unlikely that physical goods will ever carry COVID. So we are trying to work very hard with all suppliers to do what they can to maintain the integrity and security of their supply chains and not to get stuck in situations that might make them insecure. And we're particularly keen to ensure that the trade in medical equipment and supplies, I mean, there's no need for medical equipment and supplies to be put into quarantine or to be held up. In fact, they should be given priority passage, but we're finding it very difficult to get medical equipment transported to where it's needed. And so generally the issue of supply chain security and supply chain resilience and dealing with market failures is top of mind. Secondly, we are working very hard on trying to make sure that counterfeit medicines and medical equipment are not made available. And there we've got to identify quickly if there are fakes, and particularly fake cures coming out. Secondly, we have to work with the authorities to deal with these fakes. And thirdly, we have to make sure that there is accurate information on what particular medications are appropriate. We had some very unfortunate reports of large numbers of deaths, for example, of people drinking methanol because they were told that that was good to treat COVID. And the consequences is really being very serious. And then lastly, we are all working hard on the effort to try to develop new drugs and vaccines that will work for COVID. So there are clinical trials underway of antivirals and other medicines all over the world. Those are being supervised by the World Health Organization. And the effort to develop a vaccine is a huge race that's going on in many different parts of the world. My only caution on this is that even when we have a candidate vaccine, it will take at least 18 months to move from having the candidate molecule to having it available in large, large numbers so that everybody can get vaccinated. Last point on the medical equipment and the supplies. I've told you that we are worried about the market failure on personal protective equipment. A few other essential areas that need attention. They include pulse oximeters for measuring the oxygen in the blood, intravenous infusion pumps, and also masks and the like for those health workers who need them to keep themselves safe. Let's think a little bit about now what a COVID-ready society is going to look like, because this virus is going to be with us for the foreseeable future. We are going to need to be able to keep ourselves safe and protected from further outbreaks, even though there will be some people getting ill from time to time, because the virus will stay still being transmitted stealthily within communities. And so the capacity to be able to identify people who've got the disease quickly and to be able to interrupt transmission by finding those who are infected and isolating them is going to continue to be necessary even once the present wave of big outbreaks has gone. We call that COVID-ready society. We call it being COVID-ready. And that having that COVID readiness in place is absolutely essential before lockdowns are released and a new activity can restart. Because if we don't get ready to be able to find people with COVID in any community, then by releasing a lockdown, all we do is have people with virus back out into the community. We get a whole great big new outbreak, and then we're back once again having to have lockdowns reimposed. And nobody wants to go on having lockdowns like what we've got at the moment. We're already picking up signs in different parts of the world that a lockdown is really, really difficult for poorer people, people who are on daily wages, or people who really don't have secure employment. And it seems a terrible sacrifice and struggle for them to have to be able to cope with that and not to be able to get what they need. So we are asking all governments to do whatever they can to make their lockdowns short, to institute them early on in an outbreak so the issue is not too massive to deal with. And we're also suggesting that if the lockdown is to be lifted, to make absolutely certain that there is absolute readiness right throughout society to find people with COVID and to enable them to be isolated quickly. And we suggest that in lifting the lockdown, it's done bit by bit. It's not everybody suddenly starts moving around and having their normal social life and their normal economic life. Do it bit by bit. Okay, so let's now just spend a moment now looking through some of your questions and seeing what are the points you've raised. So there's some, okay, I think I will not look at the chat line. It's clearly designed to distract everybody. So are you collaborating with ACAPS? So I need to know what ACAPS stands for.
It's a platform tracking cases.
Okay, so I'm working with several different groups who are tracking people who've got the disease. The statistics for the World Health Organization come from government sources. We know that in some cases they don't have all the data, but that's what we work with. And that's the basis of knowing where the challenge is. But I'm now hearing of several organizations who've set up platforms at community level, which are actually tracking people who've got the disease. They're checking in that they're ill. They're sending details on a web app, and then they are checked on regularly from a center, which is keeping an eye on the different cases, and they're followed up to see whether or not they are particularly ill and need special attention. The same approach is also used to identify older people who are on their own who may need support, but also we're getting increasing reports that confinement, as it's called, or lockdown leads to quite a lot of mental upset. And for that reason, we also need to be on the alert for people who are getting very distressed. There are reports also that some people, when they're at home, get so frustrated, they actually are violent with each other, usually men against women. And so there is a major effort now to try to reduce domestic violence. Those of you who access platforms like the one we've heard about here, which is ACAPS from Norwegian Refugee Council and Save the Children, if you've got information about them, please let me know. I don't know about this particular platform, and I will try to find out more. I think Alice Rain, if you're sending a message on your phone, if there is a message on the back of your phone, you'll have to hold it closer because I couldn't read it. Now, the second question. Last time you spoke about steady state. Is this the most likely scenario we should be planning for in your current judgment? And if so, what steps should governments and business be doing now if this is the most plausible situation? This is a really, really important point. Thank you for asking the question. The big outbreaks that we have at the moment, some of which are really causing huge distress in different parts of the world, will subside. It'll take time, but the combination of finding people with the disease and enabling them to be isolated, plus the stringent physical distancing conditions that are being put in place to reduce opportunities for transmission, they'll get the outbreaks down, hopefully sooner rather than later. But that virus won't have gone. And that's why I'm now referring to the COVID-ready state. Sometimes I refer to it as the steady state, that everybody will need to have in all communities so that they're able to keep safe, even though this virus and its illness is still around. And of course, the virus can't exist outside people. So that means that we do have to be on the alert for people who are ill with this particular disease, and we have to help them to know that they've got the disease, ideally through testing, and to be isolated. So the steady state that's going to be needed for the foreseeable future is a very high degree of alert and a very widespread capability with public health services to be able to find people who've got the disease or to be accessible to people who've got symptoms, to test them, and then to have places where they can be isolated and looked after, and health, especially getting healthcare if they need it. So that is the most likely scenario. And to transition to this steady state, we have to do the building of these basic public health services in communities during the lockdowns. And that's happening. For example, I was just talking today with some people in the United States who are explaining the very intense work underway in the current phase to build up community-based public health services, to bring in volunteers, sometimes students, sometimes employees who've been laid off from their normal jobs, to support the public health professionals who are keeping an eye, simply keeping an eye, we call it surveillance, on what's happening in the community. And it does mean really knowing where people are, being connected to them, and if they are sick, getting to find them, take samples for a swab to see whether they've got the virus, and then helping them to isolate. That's the steady state, and that'll be the steady state until we have a vaccine against this particular disease. And so what I'm asking is all governments, but also all businesses, all community organizations, to be thinking about how they're going to behave. Some will be quite strong on the physical distancing. They will say, well, if we're going to have a meeting, we've got to sit 2 meters apart from each other. They'll say that in our canteen, we have to sit 2 meters apart from each other. In China at the moment, this physical distancing is being imposed in many locations because they know that they're susceptible to the disease coming back, even though they've managed to push their outbreak down. And so that's why physical distancing in parts of China is the norm. And that capacity to do the testing will also be the norm. I don't think that means that all gatherings will continue to be prevented. I just think that we will be asked in many locations, particularly if we know that there is COVID virus moving around in those locations, to be super respectful and to be careful with those who are most susceptible, which is older people. And I think that's going to be with us for quite a number of months. I don't think the lockdowns will go on for months, but I think kind of being very, very careful about how we behave and also being careful to make sure that our health services are strong and that our health workers are treated as the most important people in our society, because we're going to be dependent hugely on them. All the time, the purpose of having this COVID-ready state, to be able to find early outbreaks and suppress them, basically. The whole purpose of that is to prevent the sudden appearance of these giant outbreaks, like what we're having at the moment in New York, or what we're having at the moment in Northern Italy, because these giant outbreaks really paralyze health services and they do require the imposition of lockdown. So you end up with a huge social and economic and health system disruption simply because we haven't quickly prevented the outbreak from growing. So there's a huge societal and economic as well as public health imperative of being quick and being robust when you get an early case, and that will be the COVID-ready state. What are your views on whether we appear to be seeing lower R0, which is the number of people who are infected by an index case in the global south? Well, I am waiting to see just what sort of transmission there is in what you call the global south, or in developing countries. There is a feeling that in warmer climates, this particular kind of virus is less easily transmitted. The feeling is that when you are sneezing or coughing, that the droplets don't travel so far, are much finer, and that the virus gets killed much more quickly. And so that situation leads us to hope that in poorer countries, there will not be such rapid spread of the disease, and then there will not also be such high levels of mortality, because there will probably be fewer elder people, the people in the age range that are most susceptible, but we don't know. And to be honest, I am quite concerned about some of the data that I'm seeing coming from different southern countries, even though I'm very pleased to see the speed with which, for example, India, Kenya, South Africa, Chile have all been working to try to avoid the situation where there is widespread distribution in society before action is taken. So my views are, I suspect that the doubling time in developing countries will be slower, because I am very hopeful that they will that the virus will not be so viable in dry, hot weather. I'm also hopeful that there will be a real reduction in the mortality because of the different age structure of the population. However, I don't know what people who have got less good nutrition will do when they get infected. And I think we have to remember that the testing rate in many developing countries will be even lower than it is in Europe and the US, because it's quite difficult to do the virus tests using PCR, even though a company came out very recently with a rapid test kit. The reality is that testing in many geographies, particularly in poor countries, is just so difficult to do. So we may well not fully know the magnitude of the situation in developing countries until things have really been going in poorer countries for some weeks. What is the impact of the crisis on small and medium enterprises? I wanted to focus particularly on small and medium enterprises You see, I've mentioned before that this is a crisis that, when you are trying to control it, involves really major action to try to slow down and even lock down the economy. So you're locking down the economy, you're saying to people, do not go to work. If you can, work from home. Well, that's fine for people who are connected to a corporation, who've got the internet and they can do everything by Zoom. But if your work involves direct contact with people, if you're in the travel industry, if you're in retail, if you're in hotel and hospitality and other similar roles, and if you're not on a monthly wage, but you're on daily wages, or if you've got a very small company with a few employees, then life gets very difficult. And so I'm listening to banks and I'm listening to companies like PayPal and others, and they say, yes, we're doing all sorts of things to try to support people who are on daily wages or they're small and medium enterprises. But the people who work in small and medium enterprises are already telling me that they're finding it very difficult. Let's say it's somebody who's just invested all their savings in buying a restaurant and they've been told to shut their restaurant and they've got to keep it shut for 2 months or 3 months. It can be very, very difficult. And especially if you're in a country that's not supporting small and medium enterprises. So we are actually developing a view that small businesses, what we call SMEs, are hardest hit by the virus, but also they're very hard hit by the measures put in to contain it. Because lockdowns do mean disruptions to supply chains, and they mean the drying up of revenues for these SMEs. The demand plummets because customers not going out to the restaurant or going out to the coffee bar or going on a short holiday or other such things. And hotels in particular are having to lay off staff, and large retail chains are also laying off staff. So it's big and small, but it's the small that tend to go down quickest. And this problem is serious because the SME, this is a small business, accumulates debts towards suppliers and to employees very quickly. And so what they do is they go to their bank and say, can you perhaps lend us some money, but on very low interest? Or can you allow us to have a holiday on a repayment of our debt? Or can you go to the local council and say, can you forgive us paying our rents? And a whole series of actions are necessary. But for the SME, it's a really tough job of going around to see who can help out. And this problem is really serious in developing countries. Listening to reports today from Mumbai, listening to reports from Nairobi, listening to reports from Sao Paulo, they're all saying it is tough and the businesses are really struggling. And even though the lockdowns have only been in place for 1 week or 2 weeks or perhaps 3 weeks, the challenges are huge. And this is particularly the case with what we call the informal sector. People who are on wage earning jobs, who get a bit of cash, who don't have any savings, and who really struggle when prices go up in the shops because of scarcity. So this whole challenge of small and medium enterprises is right at the top of our minds. So we're recognizing that this is a time when direct cash transfers are needed to workers in small and medium enterprises. Direct cash transfers are needed to go to informal workers who have perhaps just got no cash, and measures to support the businesses in terms of emergency loans, waiving of interest payments, or a special procedure to try to help them avoid being bankrupt have to be put in place. We're working with the International Chamber of Commerce on this, and delighted to do so. I'll speed up a bit now. 5th question, what's your view on the use of cloth or homemade masks? There are some studies that shows that they do not help and can harm, while others claim that they can be helpful. There are grassroots movements that can make 1 million masks. Is this misguided? Here's the situation. I'm working as a health worker, say in rural India, not far away from a town. I know it's likely that people with COVID are going to turn up to my health center. I've got no masks and no gowns and other protective equipment. I know that it's going to come, but the distribution hasn't come yet. Yet I'm worried that I'm going to get COVID now. What do I do? Answer, you have to make your own mask. You have to try. You have to do anything you can to try. not because the homemade mask is perfect. There are all sorts of challenges, but because it's better than nothing. And now what's happening is that there are a number of patterns appearing on the internet for how to make homemade masks, how it can be done locally. And in India at the moment, a lot of people are wearing homemade masks. And the way I see it is as follows: anything that can reduce the likelihood that if I'm sick, I'm transmitting the virus to other people. Anything that can reduce the likelihood that if I'm a health worker, I'm going to get infected when I see a patient, we should use it. Because no protection technique is absolute. And a mask made out of 5 layers of surgical gauze can be just as good as a mask that you purchase, and perhaps nothing like as perfect as the true N95 mask, but these masks can reduce the risk of droplet infection, and that's what we're trying to do. So I'm saying if you can't get hold of masks from your health service, do please follow one of the patterns for homemade masks and do it yourself. And if there are grassroots groups who are prepared to make masks and make them available, please do so. Obviously, if the real thing comes, then health workers will wear the real thing, but these could be a lifesaver, especially if there's nothing else for people to use. Is WHO testing plant antivirals? So WHO itself doesn't have a laboratory or a test ground where it tests things, but what it does do is it coordinates trials by other people. And the moment it's involved in a number of trials of compounds, some of which are natural, some of which are synthetic, that have activity against virus, called a solidarity trial. Now, I'm not able to tell you whether or not there are specific plant-based antivirals being tested. I know from the questioner that you've got some strong evidence about it. And I think that that's something that I will have to find out. I mean, here's another one, that there is a lot of talk about the efficacy of chloroquine and hydroxychloroquine. WHO is working with others who are involved in very systematic trials of all the different drugs that are being touted around, because everybody is worried that there are claims being made for drugs based on various different experiments that are being done. But we really are concerned if those claims are touted on the internet and they're not based on any foundation. Is there, in question 7, is there any way of tracking infection networks without infringing upon human rights? Good point. When I worked on Ebola in West Africa, we spent a lot of time trying to set up systems for tracing people who had been in contact with an infected patient. It's absolutely essential that you do that, because you have to ask the people who've been in contact to stay under surveillance and indeed to keep away from other people to try to stop chains of transmission developing. And I must say, at the beginning, people didn't like that. They felt it was intrusion. Over time, what we did was to negotiate with community leaders, and they said, okay, we will develop our own systems for contact tracing using our own networks, but we won't do it using your techniques. And we fairly quickly realized that we had to work through local people using their systems. It'll be difficult, I think, on COVID to automatically rely on all community-based systems, because one of the things we've learned is that you have to be really rigorous with the isolation, the case finding, and the contact tracing. Otherwise, before you know it, a great big new outbreak gets set up with huge consequences. So each government and each community is having to weigh up whether or not this surveillance of the population to find people with the disease is okay to do, given that it does reduce individual liberties. And there will be communities that have to decide whether or not this capacity for governments to be able to keep an eye on what's happening is something that they will tolerate or whether they will reject it. And you can understand that there's always a toss-up on it. But it's very difficult in this kind of work when you're dealing with a really acute outbreak. It's highly infectious situation. It's very difficult not to have a pretty close eye on the people and to be able to follow them and track them. So I think there will constantly be debates about getting the pandemic under control and getting COVID-ready states in position on the one hand, and people's personal liberties and rights on the other. just as there will be debates about whether or not all this is worthwhile, or whether we should just let the virus go through society and cope with the fact that 2% of people will die. And there are people arguing all sorts of moral and ethical questions on this. Question 8, during the gap between peak and a vaccine, you said maybe 18 months. How can we tamp down hotspots using anonymized tracking data? Well, there's a lot of work underway using actually data from records from cell phones that have been anonymized. This is not work I'm doing, but I've heard about it. The data that have been anonymized, but they are, at least there are geographical coordinates. So it should be possible using certain code words to find out whether or not there appears to be a cluster of people with disease in an area. And that kind of work is underway now. It's very intense. It's not as good as human beings, quite honestly. And so I'm waiting to see whether that, what they call big data work is going to work. Question 9, how long until we can have testing that can be done at home by the patient? I don't think it's far, but we're not there yet, because it's testing for a virus, and testing for a virus involves a number of quite delicate steps that require particular temperature, particular time, particular reagents, and turning it into a nice simple test that you can do with a finger prick is not there. But what we will have quite soon is a finger prick test that will tell you whether you've been infected with the virus, what's called an antibody test. And I reckon antibody tests will come available in a matter of a month or two. There are already some antibody tests available on the internet, but the general feeling at the moment is they're not sufficiently reliable, i.e. they're neither sufficiently specific or sensitive to be used for getting really good data. They cross-react with other viruses. Question 10, what is the WHO message on testing? Quite simply, the message is you need to be able to test for the virus in people in order to know where the disease is. If you don't test, the people themselves don't know what's going on, and you don't know what's going on in the community. But we have to be realistic. There's actually a shortage of the necessary reagents and other materials for virus testing in every geography. And so there is a huge pressure on the manufacturers to ramp up manufacturing so that testing can be done. First priority for testing, health workers. They need to be able to be tested at regular intervals to make sure that they are not infected, because you want to make sure that they don't infect patients, but also you want to protect the health workers. Second group that need testing, people with symptoms, even mild symptoms, so that they can be knowing their status and so that they can be it can be made clear to them they've got to stay isolated. Then more widespread testing, that will come, and that will be a part of the COVID steady take that I talked about before. Question 12, what is your view on masks, for example, when at the supermarket? Do they actually offer the wearer protection from being infected by other people, or is that a misunderstanding? Well, there are some reports that have come out quite recently suggesting that there may be a value in wearing a mask if you are worried about being infectious, even when you are going through an airport, if you still do, or going to a supermarket. Why? Because there will always be, it is thought, some people who will have COVID and be infected without having symptoms. So this debate is underway. Here's my position. The people who should be wearing masks at the moment are the following. 1, people with the disease, to reduce the risk that droplets will transmit 2 meters. Number 2, health workers or anybody who is in close contact with people, very close contact with people who might be infected. Health workers first, but it's also people, receptionists in health centers and things like that. Number 3, after that, it's a wider population. And I think that I would start to think about wearing a mask quite soon. If there are enough masks available in the world for all health workers to get the masks they needed and for all infected people to get the masks they needed. So at the moment, any mask that I have is put in a drawer and is ready for the day when I develop my fever and my dry cough. And then I will start wearing it because I will want to make sure that anybody who's close to me on purpose or by accident is protected. So I hope that's clear, but watch this space. The instruction on masks might well change. Number 13, I just want to say one thing, sorry. things change all the time. Somebody said to me, why do governments keep changing their policies every 2 or 3 days? Answer, because we're learning about this virus. It's only 4 months old, and we're having to learn very, very fast and then pivot our plans very, very fast. So don't get mad when your government changes its policy, or if your institution changes its policy. That's just responding to the new information, and that's how it should be. Right. So now we go to the complexities of vaccine development and global rollout. Can we assume that the COVID-ready state is going to be in place for several years? Well, what I said just now is that I do think that vaccines are about 18 months. 18 months because you have to develop the vaccine, and then you have to test it, and then you have to give it a clinical trial, and then you have to get it licensed in different countries. And then once it's been licensed in different countries, you have to then take it and make sure that everybody can get it, because you don't want just the people who've got the wealth, the rich countries, to have the vaccine. You want everybody to have the vaccine, and particularly health workers. They're the people who worry the most, health workers in poor countries who don't have protection. So I think it'll be 18 months before we've got sufficient quantity of the vaccine, and then it'll be probably another few months to make sure that the vaccine can get out and to where it's needed. I was talking to a colleague recently, and I said, how long will it be before we get the vaccine? And he said, remember, coronaviruses are quite difficult to develop vaccines to, so don't assume it will be 18 months. We might actually be having to do this for quite a lot longer. So that means that the capacity to be COVID ready and to organize our societies so that we are going to be able to live with this virus is actually going to be something we've got to focus on. We've got to focus on it now as we get out of these very big outbreaks, the very damaging ones. We've got to hold it in place, and we've got to be comfortable between countries as to what that means, so that we don't get discrimination within countries, between different areas, and between countries on the basis of a rumor that a person is coming from a COVID-affected area. This is going to be tough work, and it's going to be work that involves countries working together. So now we've got question 14. You mentioned no need to quarantine supplies, but there's a lot of information around about how the pathogen hangs about for different lengths of time on different materials. Is this correct or not? I checked today, actually, the latest guidance from my colleagues in WHO who are working on this. The overwhelming majority of people getting COVID get it from droplets that are secreted in the respiratory system when you cough, when you sneeze, even when you're singing, apparently. And that's the droplet spread. And that's the spread that usually doesn't go further than 2 meters. There's some evidence that the COVID virus can be transmitted inside closed air circulation systems where there's not a fine filter, as in some ships. There is some evidence that the COVID virus can stay alive in a droplet on a surface, and different surfaces seem to have different life periods. And that's why we're very fussy about cleaning, hand washing, and people really trying to avoid, as I often do, putting their hands on the surface and their hands on the face. But I do not believe that this virus hangs around for example, days on produce. It would absolutely certainly die in a hot environment quite quickly, within an hour or two, and in a temperate environment, perhaps 3 or 4 hours. But it's really important that we are aware of that. And there is some good stuff on the World Health Organization website about how long these things hang around for. And I'd be very keen that you look at that. Now I'm going to question 15. As the world looks forward to preventing future pandemics, how is WHO coordinating with the UN system, UN Environment Programme and governments to integrate the protection of nature with the protection of human health? For some years, we've all been trying to find the intersection between human health, animal health, plant health, and the health of the broader environment. And there's no doubt that we really only understand threats to health, but also influences that keep us strong and good if we see ourselves as part of nature and connected to nature, and actually respect the nature with which we live. That, in that way, and if we showed that respect, we might be able to deal with some of the other massive challenges we face besides the threat of disease, such as the destruction of nature, the reduction of biodiversity, and also, of course, the big anxiety for all of us, the rapidly accelerating changes in our climate. So I do think that the future pattern of health will go beyond just looking at a pathogen causing a disease, in this case, the coronavirus causing the disease, but we will have a much more holistic view of health. Sometimes people refer to it as planetary health, and that will become more dominant. Let's see how this evolves, but certainly the Secretary General of the United Nations, in a report that he wrote yesterday on the impacts of the COVID pandemic, said, you know, now what this teaches us is that we have to have a much more holistic view about what we all need to do to plan not just for our own future, but for the future of coming generations, and that matters so much. Question 16, is there any concern about insect vectors, e.g. mosquitoes? I have not heard any reports of COVID-19 being insect-borne. Of course, one never rules anything out, but that's absolutely my truth, that I've not heard that. Question 17, given the economic impact of the crisis, do governments need to choose between saving people or rescuing the economy? That choice is being presented by a number of leaders right now, and typically they talk about balancing between saving the economy and looking after COVID. But there's one piece that is missing when it's presented as a dichotomy, and I want to try to explain very quickly. If you find an outbreak of COVID in a community, one or two people in a cluster of cases, as we call them, you must act really quickly to make sure that they are unable to transmit the virus to others. And if you can do that fast, then you don't have to worry about trouble to your economy. It's just a small health problem, some people suffering, but you deal with it very quickly, and the rest of life goes on around you. It's a minimal thing. Yes, there may be some excitement because people may be asked to stay inside their houses or homes for 14 days, but that's easy. And that's what's happening in Singapore. It's what's happening in South Korea, and that's how they're doing it. They're living with the COVID and they're keeping their economies going. You only feel that you have to make a great big choice, either if you haven't got the capacity to find and deal with outbreaks quickly in place, or you've got a huge outbreak where you have to actually have a lockdown just to try to take the heat out of it. Question 18. Can you share efforts being made to raise awareness of fake COVID-19 medicines and treatments that are being distributed? I mentioned to you, there's a lot of work underway on counterfeit medicines. And I thought I'd just go back to this work that's being done. And this is work by the International Chamber of Commerce. And they say that there is quite an alarming rate of fake medicine use underway, and that Interpol has got an eye on this, and it's finding that unauthorized antivirals, counterfeit masks, poor quality hand sanitizing gels are actually being sold across the world, and they had to be seized by Interpol in a big operation that's been underway recently, looking at illegal sales of online medicines. And within this crisis, there is a sense that, of course, people are trying to make money. And we will see that. And it's opened up also some weaknesses, as I said just now, because people are trying to move supplies very quickly. It's weak. Here we are trying to have a video conference, and we are invited to see things that are not relevant to what we're talking about. There's all sorts of funny stuff happening. And this is the nature of this, because we're operating out with our normal system of controls that enable us to function efficiently. And so I think that we do need to recognize that there is a lot of counterfeit medicine and counterfeit medical goods sales going on. I don't really have a simple solution to this, except really we have to go to trusted suppliers, because a counterfeit drug is really a very lethal thing. And I've seen it so often. I've seen counterfeit antimalarials. I've seen counterfeit antibiotics. I've even seen counterfeit anti-epileptics, which is really dangerous. And so I think that I would counsel everyone to buy from reputed suppliers. And I think that we have to just recognize that the whole online trade does offer very many opportunities for us either to lose money on getting nothing at all, or to spend money and get stuff that's no good. Even COVID-19 testing kits seized in Los Angeles in mail from the United Kingdom going somewhere that was just no good. And I think that police services all over the world using their intellectual property services are following this up. That was on that. Yes, I'm just going to hold on to that one because it's been worrying me a lot. And of course, the World Health Organization is very worried about it. Question 19. What are the chances of a global initiative to coordinate the international response to the crisis? Increasingly high is my answer to that question. The G20, that's the 20 wealthiest nations that actually together have most of the world's wealth, met last week and committed to doing everything that's necessary to stop the pandemic. And I believe that this week there will be a growing request for some kind of task force of the G20 linked to the United Nations and the World Health Organization. They have to be in the middle to hold on to this. This is a medical crisis, and I want to be sure that the medical people very much stay at the center. They do know what's going on, and it would be really unfortunate if they weren't continuing to be directing the response. Why is it difficult to develop vaccines for coronavirus? I'm stumped. I can't tell you, but I know from the people who do this work that they find it particularly difficult. Question 21. Are there any standard practices for ensuring safe distribution of supplies within local communities? We are very clear on this. This will require the involvement of security people to protect medical supplies. In the foreseeable future, the shortages will mean that these become very heavily valued items. They will be stockpiled, they will be stolen, they will be used as currency. And I am personally very disturbed about that, because each time supplies are stolen, then that's one more health worker whose life is put at risk. I know of a surgeon in Britain who died very recently. He was just doing his job and inspecting a patient with a sore throat. He was in his 50s. And that's what really worries me, is that unsuspecting people will end up getting ill and dying. And in some cases, that will be because somebody's stolen their vital protective equipment or their mask. And I really don't want that to happen. Question 22. What are the future narratives that we're going to write? Well, we've got one that we're just trying to finish on lockdown and how to manage lockdown and how to come out of lockdown. And I'm just doing the finishing touches to it. I just had a further discussion with colleagues today on what are the criteria for coming out of lockdown. And then I've got another one coming, which my colleagues and I are working on, which is what will life be like in what I call a COVID-ready state when we are coming out of these outbreaks. And we'll go on producing narratives on things like how can we deal with COVID when we don't have electricity, we don't have tests, and we don't have masks. And we're going to try that. That's quite tricky because you don't like to give advice about how to cut corners. You want everybody to have the ideal, but we do know that in real life, the ideal is not going to be available. So we will do that. And so that's what's coming, and it's on www.4sd.info. And then there's a little button, and that's all put together by our colleague Twee, who organized this. And then behind the scenes, there's Florence, who's sitting on my right, who takes the questions that you put and makes it easy for me to read them, and also deals with the spam, which has been quite tricky this time. And then a little bit far away, because we're all separate, is Joe, who's taking some of the questions, and John, who's taking some of the questions, and Catherine, who's taking some of the questions. And they are then putting them into a composite that goes to Florence, so she writes them down. And then behind the scenes is Magali, who organizes everything, and Saber, who helps us make sure that we can pay our bills. And I'd just like to thank all those amazing people. Some of you who've come on our immersions, I see somebody here, Alice, you have met these people and you know what they're like. And we are just committed to doing everything we can to encourage what we call systems leadership. And it's living systems leadership, which is about humans in systems, because we believe that humans working together inside systems are capable of transforming anything to do with all the big challenges that we face. There are rocky roads on the way, and we've got one big challenge right now. But we're seeing people working together, dealing with the complexity of this pandemic challenge all over the world, with ingenuity, with passion, and with love. And that's what's holding us together as a human family. And it's that will make sure that this pandemic is contained and suppressed in a humane way that respects human rights and that brings us to a world where we are stronger in the face of adversity. And that's all from me. Thanks again to all our team. Thanks to you for being with us.